Everyone, welcome to RCE. I'm pretty sure you're all excited to learn about the law today. So today for RCE presentation, we'll be discussing Oregon law and tying it all back to OHSU. Before we go ahead and get started, we'd also like to introduce you to the P3 intern team. We've been interns for almost 2 years now, and there's currently 4 of us at the inpatient within 4C, and then there's currently 2 of us staffing down at the ambulatory care infusion site at the waterfront. So I'll go ahead and introduce myself first. My name is Monica Dang.
My name is Jumana Alcaboo. My name is Lisa Bin.
Ian Gibson.
I'm Munira Ibrahim.
I'm Shreya Ramani.
Okay, and before we also get started, we like to present a statement of disclosure that we have no actual or potential conflicts of interest with relation to this program. The purpose is educational in nature and no funding was provided. So here are some definitions and acronyms that you'll see us using and referencing throughout our entire presentation. I'll give everybody a couple seconds to do a quick skim through, and I'm pretty sure you're already familiar with some of it already. And here are our learning objectives for today. So our first learning objective is understanding how Oregon laws and federal regulations guide pharmacy practices and ensures compliance at OHSU, review how pharmacy law becomes a rule in Oregon, explain the responsibilities of a pharmacist in charge, and gain an understanding of how OHSU leverages policies and procedures to support pharmacy practice as required by the Oregon Board of Pharmacy. All right.
Here are the topics that will be covered in this presentation. Starting off with regulatory overview, pharmacists in charge, components of the self-inspection form, common compliance issue, and then we'll touch on the pharmacy quality improvement plan. And lastly, we will wrap this all together for our final takeaway. Moving along into regulatory overview, we'll begin with the role of the Board of Pharmacy, who is responsible for implementing and regulating Oregon pharmacy laws. The board is a state government agency created by Oregon State Legislature. The role of the board can be divided into 3 components, starting off with oversight and compliance, public health initiatives, and policy adaptation. In terms of oversight and compliance, the board conducts pharmacy inspections and audits and regulates licensing to ensure adherence to the state laws. The board has public health initiatives to promote safe medication practices and address substance misuse. Also, the board collaborates with agencies like the OHA to support public health priorities. Lastly, there are policy adaptations where the board updates and implements rules based on federal standards. Our interaction with the board falls under different encounters, from registering our licensure to escorting the board during pharmacy inspection or audits to completing a continuing education program like this one, or attending a rulemaking hearing. Now, for OHSU to stay compliant with the board and practice pharmacy, OHSU has written policies located on MCN. And this is the OHSU Policy Management System to access healthcare policies. MCN is not an acronym that OHSU synthesized, it's the vendor name. To access MCN, visit the O2 webpage and locate the banner on top, click the Healthcare tab, then click on Healthcare Policies, and this will take you to a new page. On this page, locate Find Policies and Resources for Healthcare, and click on the MCN or Lucid hyperlink. Within the pharmacy department, the Pharmacy Performance Improvement and Regulatory Compliance, known as the PPIRC Committee, discusses pharmacy practice adaptations and reviews policies housed on MCN. These policies are reviewed in cycles ranging from 1 to 3 years and are dependent on Oregon's rule. Now, we mentioned that the board is responsible for implementing and regulating pharmacy laws. Oregon pharmacy laws can be divided into 2 categories, statutes and rules. Statutes are part of the Oregon Revised Statutes and are enacted by the state legislature. For pharmacists and technicians, 2 key chapters to know and follow are chapters 475, which focuses on controlled substances, and chapter 689, which governs pharmacy practice. The board is responsible for regulating these statutes and operationalizing the OAR. The OAR, the Oregon Administrative Rules, are the interpretations of the state law, developed by regulatory agencies that set the day-to-day rules for compliance and practice. These rules are found in Chapter 855. Think of it this way. ORS Chapter 689 sets the what, the laws and the frameworks, while OAR, Chapter 855, defines the how. The ORS and the OAR are accessible on Oregon's Board of Pharmacy Laws and Rules page. Ultimately, pharmacy practice in Oregon operates at the intersection between state-specific rules and federal mandates.
Okay, now let's focus on Chapter 689 of the Oregon Revised Statutes, which establishes the legislative framework for pharmacy-related laws and regulations and explain why is it critical. So Chapter 689 establishes the foundation for pharmacy practice in Oregon. This includes defining the profession of pharmacy in Oregon, establishing licensing standards for pharmacists, technicians, and interns, delegating enforcement authority to the Oregon Board of Pharmacy, and prioritizing public safety and ethical pharmacy practice. Now, for licensing requirements, this sets clear expectations for qualifications such as completing the necessary education and passing exams and undergoing background checks. It also provides a clear and organized process for pharmacists, technicians, and interns to apply and obtain their licenses. When it comes to continuing education, the focus is on keeping pharmacy professionals current with the latest advancement in healthcare. This ensures that they deliver safe, effective, and evidence-based care to patients throughout their careers. Now we continue on the legislative foundation for pharmacy practice, focusing on two additional key points: ethical standards and delegation of authority. For ethical standards, these emphasize the importance of maintaining professional conduct and ensuring that pharmacy professionals prioritize patient care above all else. Ethical standards also play a significant role in preventing conflicts of interest, which could compromise decision-making and patient safety. Delegation of authority is that the Oregon Board of Pharmacy is empowered to enforce this foundation through licensing, which grants credentials to qualified pharmacists, technicians, and interns. Compliance enforcement, ensuring all practitioners and pharmacies follow state law and administrative rules. For disciplinary action, that means taking corrective measures, such as license suspensions or revocations, when there are violations that put public safety at risk. So, concluding that all these key points complete the foundation for ensuring safe, ethical, and compliant pharmacy practice in Oregon. So to wrap up, Chapter 689 establishes the foundation for pharmacy practice in Oregon. Now we'll take a closer look at Chapter 855, which translates these laws into actionable rules that guide day-to-day pharmacy operations. So the purpose of Chapter 855, this chapter sets the safety and ethical standards for both pharmacies and pharmacy practitioners. Its primary goal to protect public health by ensuring that pharmacy operations are carefully regulated. Ultimately, Chapter 855 ensures that pharmacists and pharmacy outlets are equipped to operate safely, ethically, and in alignment with modern healthcare standards. Some of the key areas Chapter 855 covers are licensing and qualifications. This section establishes the minimum requirement for pharmacists, technicians, and interns to obtain and maintain licensure, including necessary education, ethics, and professional standards to ensure that they are qualified to safely and effectively serve the public. Second is operational standards. Key areas include handling, storing, and dispensing medications. This ensures medications are managed appropriately, reducing errors and ensuring patient safety. Confidentiality and controlled substances. Compliance with HIPAA laws are for patient privacy, and strict regulations for controlled substances management, and are emphasized to protect the public trust and prevent misuse. The last one is disciplinary actions. Oregon Board of Pharmacy has the authority to investigate and penalize violations of OAR Chapter 855. Penalties can range from license suspensions or revocations to fines, and depending on the severity of the violation. This oversight is to protect patient safety and public health, and that they are addressed swiftly and effectively. So by covering these areas, Chapter OAR 855 bridges legal requirements with practical operations, creating a framework that promotes safe, ethical, and compliant pharmacy practice.
As we pass the halfway mark of the regulatory overview section, let's review what we went over. We discussed the OBOP role about regulating pharmacy practice through inspections, licensing, and promoting safe medication practices. We reviewed the pharmacy laws and rules in Oregon, specifically how ORS Chapter 475 and 689 practice, set the legal standards, and while OAR 855 outlines compliance rules. We touched on locating OHSU policies via MCN, which are reviewed every 1 to 3 years by the PPIRC committee. Then we discussed how pharmacists, technicians, and interns all require education, exams, background checks, and continuing education for safe pharmacy practices. Lastly, we mentioned how ethics and discipline of pharmacy practice, where ORS Chapter 869 enforces professional conduct and penalizes violations to protect public health and safety. Ultimately, we covered how Oregon laws guide pharmacy practices and OHSU implements healthcare policies to ensure compliance. Previously, we mentioned that pharmacy practice in Oregon operates at the intersection of state-specific rules and federal mandates. Let's expand on the federal regulations and its connection with Oregon's pharmacy laws. We'll touch on Title 21 of the Code of Federal Regulations and ORS Chapter 475. Let's recall, the Code of Federal Regulation is a collection of rules established by federal government agencies. Title 21 is just a section of rules established by the United States Food and Drug Administration, the Department of Health and Human Services, the Drug Enforcement Administration, also known as the DEA, the Department of Justice, and the Office of National Drug Control Policy. What's the relationship between Title 21 and ORS Chapter 475? Well, both of these rules focuses on controlled substances. Specifically, Title 21, Chapter 2, Section 1300 to 1321 establishes their standardization across the United States to regulate controlled substances by the DEA. And for Oregon to align state regulations with federal standards, we have the ORS Chapter 475 implemented, where the board enforces Oregon's law on controlled substances and more. One example is with Title 21 of the Code of Federal Regulations, Section 1306 to Part 26, and ORS Chapter 475, Division 230, where both rules focuses on dispensing controlled substances without a prescription. The federal code states that a pharmacist must verify the patient's government-issued identification, ensure the patient is at least 18 years old, and must enter the details like name, address, and birth date. And this is mirrored in ORS Chapter 475, Division 230 for pseudoephedrine. After hearing Oregon's law and the Code of Federal Regulation, how does a law become a rule? Well, we have a visual of how a law becomes a rule in 7 steps, with the first 4 focused on the slide. It is important to note that steps 2, 3, and 4 are repeated as necessary to reach a consensus and mandate the law. The first step, which is initiating the event, is triggered by a new federal law, public demand, or an identified issue which requires regulation. But step 2 is to analyze the issue, where research is conducted and data is gathered to understand the problem and potential impacts. Step 3 is to draft a proposed rule with clear rule language for review and discussion. Afterwards, in step 4, we have the board discussion, where the board debates the draft in a public session. Then in step 5, we have the rulemaking process, where there are solicit comments from the public and input from the Rule Advisory Committee. Next, in step 6, the board votes in a public meeting to approve the final version of the rule for adoption. Lastly, in step 7, the new rules becomes enforceable and is integrated into the Oregon Administrative Rules, Chapter 855, which defines how we practice day-to-day. After understanding this rulemaking process, let's dive into a rule in Oregon.
All right, so we'll go ahead and take how a rule or how a law becomes a rule and apply it to the most recent pseudoephedrine reclassification. Okay, so step 1 was all about addressing public demand. Patients wanted easier access to Sudafed without needing a prescription, but safeguards were still extremely important to prevent misuse. And with the low diversion rates already shown by the NPLEX tracking system, this demand had gained a lot of momentum. So the key players within step 1 includes the Oregon legislature, the Oregon Board of Pharmacy, healthcare professionals, and our public advocates. Step 2 was all about analyzing the issue. So here, the Board of Pharmacy reviewed data from other states showing that the NPLEX tracking system efficiently or effectively prevented illegal misuse of Sudafed, while meanwhile prescription requirements were inconvenient and had an increase overall healthcare costs for our patients. Step 3 was drafting the rules. So here, the Oregon Board of Pharmacy proposed over-the-counter access with safeguards. So this includes our known ID verification, age limits, and of course, purchasing caps aligning with federal law. And step 4 included involving public feedback. And the Oregon Board of Pharmacy here held forums and gathered inputs from pharmacists, advocates, and the public. And this ultimately led to updates such as enhanced staff training and penalties for noncompliance. Step 5 and 6 focus on the final vote. So after refining the rules, the Oregon Board of Pharmacy approved the change and officially reclassified Sudafed as an over-the-counter medication. So this rule took effect on January 1st of 2022. And lastly, within step 7 focused on implementation. So here, pharmacies such as OHSU updated their systems to integrate the NPLEX tracking system and also train staff on the new regulations. So this means ensuring that everybody could verify IDs and also enforce the sales limits.
All right. Up to this point, we've covered the regulatory overview, including some background on key chapters like ORS Chapter 689 and OAR Chapter 855, as well as an explanation of the rulemaking process with an example to illustrate how this works in practice. So with this foundational knowledge, we're ready to move on to the core of our presentation, starting with the roles and responsibilities of the pharmacist in charge, or the PIC. All right, so what is a PIC? A pharmacist in charge, or a PIC, is a licensed pharmacist in Oregon who's responsible for the legal, regulatory, and operational compliance of their pharmacy. They act as the primary liaison between the pharmacy and the Board of Pharmacy, ensuring that all laws and regulations are followed. To be designated as a PIC, the pharmacist must have at least 1 year of pharmacy practice or complete a board-provided PIC training course found on the Oregon Board of Pharmacy website within 90 days of appointment. They must also be employed by the outlet they oversee. As for the legal authority, ORS Chapter 689, Section 205 grants the Oregon Board of Pharmacy the authority to define the duties of a PIC, while ORS Chapter 689, Section 151 and 155 provide the framework for licensing, regulating pharmacy practice, and protecting public health. As for the trainings and limitations, effective July 1st of 2025, all PICs must complete the board-provided training every 5 years to stay updated on any compliance standards. Previously, this requirement was for PICs to complete the training within 30 days of appointment, but the new rule effective March 1st of 2024 extended this to 90 days and mandates the training every 5 years starting this year. This ensures PICs remain informed of any evolving standards and licensing changes, as well as enhancing overall compliance. As for the limitations, a PIC can oversee up to 3 pharmacies with exceptions for kiosks and lockers under OAR Chapter 855, Division 141 and 143. So attached, we have a resource for pharmacists to learn more about the responsibilities and requirements of being a PIC. The Oregon Board of Pharmacy offers an on-demand PIC training program with 3 modules covering qualifications, investigations, inspections, and current topics. This website is an essential tool for anyone who's preparing to take on a PIC role or for current PICs to meet these ongoing training requirements. Beyond training, this website serves as a critical tool for PICs to learn more about their operational and regulatory questions and find the answers for these, as well as helping them navigate their responsibilities effectively. Accessing these resources ensures compliance with board regulations and supports safe and effective pharmacy operations. Moving on to the PIC's responsibilities, one of the core responsibilities the PIC has is the overall operation and compliance of their pharmacy. Some of these duties include developing and enforcing written policies and procedures, maintaining accurate records, and ensuring adherence to federal and state laws. Next, we have the self-inspection requirements. Self-inspections are a proactive process where the PIC evaluates the pharmacy's compliance with state laws, regulations, and operational standards. The PICs must complete the self-inspection form annually by July 1st and within 15 days of assuming their role. These forms are used to identify and address potential compliance issues before these external audits occur and must be retained for at least 3 years as proof of compliance. And in the next slide, we'll introduce the self-inspection forms and go more into detail about their requirements and purpose. Next, we have the controlled substance inventory, where the PICs must document controlled substance inventories regularly and reconcile these discrepancies. We'll discuss later in the presentation how often the inventory counts must take place. Last, we have corrective actions, where the PICs are responsible for developing and submitting corrective action plans following inspection findings as outlined in the rules. They must also oversee any continuous quality improvement programs to ensure compliance and address any identified issues. At OHSU, our regulatory compliance team assists with this process, and all corrective action plans are routed through them rather than being directly submitted by the PIC. This support ensures compliance is managed effectively with the assistance of legal and compliance experts. All right, so we've covered an intro to the PIC and what their role is, and we've introduced their responsibility of completing the self-inspection forms. So we're now ready to take a closer look at these forms, explore what they are, the specific areas they cover, and how they play a vital role in ensuring compliance and maintaining quality across pharmacy operations, especially our workflows here at OHSU and how this can be applied to all of us as pharmacy staff. So as we can see here, the list of self-inspection forms is quite extensive and covers various pharmacy outlets like compounding, kiosks, lockers, and more. However, for today's CE presentation, we're going to be focusing on 3 key forms: the institutional drug outlet form, the retail drug outlet form, and the additional services supplement form. These are the most relevant for our presentation and will help illustrate how self-inspections support compliance and operational workflows. Self-inspection forms serve as a critical tool for the PIC as well as all pharmacy staff. Their primary purpose is to ensure the pharmacy operates in compliance with federal and state laws as well as the Oregon Board of Pharmacy regulations. These forms guide the inspection process by providing a structured framework to assess operations, identify any potential issues, and implement corrective actions proactively. The PIC plays a central role in this process as they are the ones ultimately responsible for the compliance and performance of the outlet. If any compliance issues arise, it's the PIC along with the Chief Pharmacy Officer or the CPO who is held accountable. Self-inspection forms are not only used to meet the regulatory requirements, but they can also be used to educate teams on key compliance areas, document any recent changes, and serve as a living resource that the team can consistently refer to for guidance. As we move on to the next section, we'll explore how these forms tie directly back into the PIC's responsibilities and how they remain an effective tool for preparing the pharmacy for external inspections. So as we discussed the scope of this presentation, we thought it would be important to acknowledge that the topics listed here, such as non-sterile and sterile compounding, duty to report, final verification, and more, are all critical to pharmacy operations and compliance. However, due to the time constraints within this session and the detailed nature of these topics, we won't be covering them in this presentation. Additionally, some of these practices that we have listed on the right, like final verification, pharmacist prescriptive authority, and long-term care, are not currently practiced or implemented here at OHSU. So looking at the sections within the scope of our presentation, we'll be focusing on those unique to the institutional drug outlet form, those unique to the retail drug outlet form, and the sections we find common in both. This comparison will help highlight the distinct and shared responsibilities across these pharmacy types. So the sections we have in the middle that are bolded are the sections we find in both inspection forms. This includes trainings and certifications, controlled substances, personnel, labeling, cold drug storage, and more. While the institutional and retail pharmacy practices differ significantly in their operational standards, these overlapping areas highlight the shared priorities and foundational requirements necessary for compliance and patient safety within both settings. We'll discuss these areas in more detail and tie them back to our own policies and workflows here at OHSU. Starting off with personnel. So the PIC self-inspection form outlines key requirements for pharmacy personnel outlined in OAR divisions 115, 120, and 125. These regulations ensure that all pharmacy staff are clearly identified and properly supervised. At OHSU, we meet these standards by using designated sleeve titles as shown in the example on Lisa's badge and requiring these badges to be worn at heart level for quick identification. To maintain compliance, we focus on clear supervision and accountability. So this means that during any given shift, everyone should know who they're working with. Interns should know who's their assigned pharmacist or preceptor, and pharmacy technicians must know which pharmacist is supervising and directing their tasks. Similarly, pharmacists are responsible for knowing any interns and technicians under their supervision for that given shift. This structure helps ensure safe, efficient, and compliant operations. Next, we have security and access. The pharmacy access policy ensures compliance with the Oregon Board of Pharmacy rules within OAR Chapter 855, Division 41, limiting access to pharmacy areas for security. Access is restricted to authorized pharmacy personnel that are approved by the pharmacy chief operating officer. Non-pharmacy staff may enter under specific conditions, whether that be pharmacy students with an OHSU ID or environmental services, or this can be under direct accompaniment for emergencies, IT issues, or vendor visits. Only registered pharmacists can lock and unlock pharmacy areas that have deadbolt keys, and this cannot be shared. During business hours, doors remain unlocked, but after hours, access is strictly limited to registered pharmacists. For pharmacy areas that are not open 24 hours a day, the pharmacist must unlock the pharmacy for the badge reader to activate and allow other staff to enter. This policy aligns with the board's requirements for securing prescription areas and implementing safeguards against theft or diversion. So now that we've set the expectations for our pharmacy team, we can discuss the laws and regulations that guide their roles, starting off with pharmacists. So pharmacists have specific expectations like ensuring prescription accuracy, including proper documentation of any verbal orders, as well as assigning accurate expiration dates and ensuring labels include descriptions and identification codes and more, as well as maintaining patient records for allergies and chronic conditions, conducting DURs for all prescriptions and documenting interventions, as well as dispensing medications and compliance with policies to ensure safety and legitimacy. Pharmacy technicians handle tasks such as inventory control, processing refills, managing patient paperwork, and more. According to OAR Chapter 855, Division 41 and 115, all these tasks must be supervised by a licensed pharmacist. And while we have no set technician to pharmacist ratio, OHSU evaluates the volume and type of work to determine appropriate staffing levels. This ensures patient safety and operational efficiency. For pharmacy interns, the Board of Pharmacy allows them to practice under the supervision of a pharmacist or preceptor within their defined scope. Interns are held to the same standards as pharmacists when performing any patient-related tasks. For direct patient care activities, OHSU policy limits supervision to 4 interns per pharmacist. As for non-direct patient care tasks, the pharmacist may use their professional judgment to determine how many interns they can safely oversee. Adhering to these policies and regulations ensures patient safety, minimizes errors, and supports compliance with state laws. Moving on to labeling. So OHSU pharmacy staff should ask themselves whether labels on medications being dispensed meet the requirements outlined in OAR Chapter 855, Division 41, Sections 1130 and 6270. These labeling requirements span institutional, retail, and shared elements, and it aligns with our policies for inpatient and ambulatory as well as outpatient. Staff must verify that labeling includes critical details like drug name and strength, expiration dates, and auxiliary labels for both institutional and retail settings. Additionally, institutional labels require patient location, manufacturer and lot numbers, documentation of personnel, while retail labels focus more on pharmacy information, directions for use, and physical descriptions. At OHSU, we work closely with our informatics team to automate this labeling process and ensure compliance with these standards. So we thought it'd be helpful to show an example of our labels here at OHSU, starting off with the institutional. So we have patient location, the drug name and strength, the route of administration, the expiration date, pharmacy personnel signature, as well as the barcode. And for retail, we have the directions for use, drug name and strength, physical description, prescriber information, the pharmacy information, the fill date and expiration date, and the precautionary information. So these are the policies we reference to discuss the workflows we implement as OHSU pharmacy staff within this section. This outlines the connection between the laws and regulations that we follow and the specific MCN policies that guide our operations. You can refer back to this as a quick reference for everything we covered in this section.
Okay, now we'll move on to another key chapter of the self-inspection forms, which is controlled substances. So controlled substance regulations are essential for ensuring safety, compliance, and accountability in medication management. So these rules require pharmacies to perform regular inventory checks and reconciliation per OAR Chapter 855, Division 115, Section 0210, and federal guidelines such as the Title 21 of CFR emphasize accurate record keeping and the prompt reporting of any losses. OAR Chapter 855, Division 41, Section 6610 supports quality assurance practices and the maintenance of a perpetual inventory to ensure discrepancies are quickly resolved and identified. And additionally, OAR Chapter 855, Division 41, Section 6600 highlights the importance of monitoring systems, including electronic surveillance, to oversee controlled substances from storage to administration. While this regulatory framework is comprehensive, today's focus will be on how these rules are applied to our daily workflows, ensuring efficient and compliant medication management practices. So building on our discussion of controlled substance regulations, let's focus specifically on controlled substance inventory management. As outlined in OAR Chapter 855, Division 115, Section 0210, all controlled substances must be reconciled and inventoried within 15 days of a PIC change and every 367 days otherwise. And any controlled substance must be counted every 31 days for institutional pharmacies and every 93 days for outpatient pharmacies. However, at OHSU, our outpatient pharmacy has taken a proactive approach to managing these inventories. So instead of every 93 days, we do our counts bi-monthly just to ensure that no deadlines are missed. So how do these laws and rules apply to our daily workflow at OHSU? The controlled substance management process outlines steps from procurement to reporting, and moving on, we'll discuss each step in a little detail and how OHSU focuses on these. So the foundation of controlled substance management starts with procurement and storage. At OHSU, procurement is conducted through approved wholesalers, and Schedule II medications are ordered via Controlled Substance Ordering System, or CSOS, with a DI Form 222, and these medications are securely stored in OmniCell or IntelliVault, safe with restricted access. For outpatient settings, Schedule 3 to 5 medications are dispersed throughout and stored securely as required. Once the medications are stored properly, we move to inventory management. So at OHSU, we use systems like Epic, OmniCell, and Workflow RX to track medications, and records, including order logs, are kept for up to 3 years to meet regulations and to ensure everything is accounted for. Then prescribing controlled substances must be done carefully and securely. So a pharmacist may add or amend details on a Schedule II prescription, such as patient's address, drug information, or dates, after consulting with the prescriber. And then after the medication is prescribed, it can be prepared, and the medications are prepared by our pharmacy technician. The medication is first scanned into Epic before the preparation process, and a double verification is conducted. And after the preparation is completed, it is again verified by a pharmacist before dispensing. And then moving on to transport and security, medications are transported in tamper-evident containers and stored securely in OmniCell or any locked cabinets. And these steps ensure compliance and safety. And then once the medications are given to our patients, everything is also documented in Epic, and any unused or leftover medication is logged into OmniCell or on paper in areas that do not have an OmniCell, and the waste is documented with a witness within 30 minutes. And then moving on to pharmacy waste, which is separate from patient administration waste. So any unused or expired medications in the pharmacy are separated and disposed of either on site or through a reverse distributor. And all disposal is documented to ensure accountability. And then moving on to quality assurance and monitoring, OHSU conducts random proof of use audits and variance investigations, and monitoring tools track potential misuse or discrepancies, helping to prevent any diversion. Then lastly, for reporting any loss of controlled substances, this must be reported to the DEA within 24 hours to comply with regulations. So at OHSU, we have an escalation process, and this is outlined in our 2 policies in MCN, which are reporting controlled substance variance procedures and reporting controlled substance theft and loss policy. So I know that was a lot, and we covered a lot for controlled substance, but these are all the policies that were referenced and pertaining to their laws, and they can be also used as your reference as needed. And then this is also a continuation of the policies that were used. So moving on to another crucial part of the self-inspection forms, which is collaborative drug therapy management, or CDTM. So CDTMs is where pharmacists, and healthcare providers work together to manage drug therapy. CDTMs fall under a larger umbrella called clinical practice agreements, or CPAs. Think of CPAs as the overall framework that allows pharmacists to collaborate with prescribers in managing patient care. Within this framework, CDTMs are just more specific to drug therapy. Historically, CDTMs have been used for outpatient, whereas CPAs have a greater focus in inpatient settings. At OHSU, CDTMs play a critical role in helping pharmacists support patients that are transitioning from hospital to outpatient settings. So furthermore, OHSU practices under OAR, Chapter 855, Division 115, Section 0315, and this states that the agreement for CDTM must be reviewed and updated every 2 years with the requirement to complete initial and ongoing competency assessments for any specific therapeutic areas that are covered in the CDTMs. However, a limitation to CDTMs is that pharmacists are unable to make any therapeutic substitutions unless specifically authorized in the agreement. So at OHSU, some of the CDTMs that we focus on are biosimilar stewardship, which is mainly used in our ambulatory care clinics. And so by reviewing formulary options, insurance requirements, and patient-specific factors, pharmacists can adjust therapies to provide optimal outcomes while reducing any costs for patients. And this process includes documenting changes in systems like Beacon and maintaining seamless communications with our providers. Then for inpatient settings, a common CDTM used are pediatric dose rounding. And for this ensures precise and safe medication use for our pediatric patients. And pharmacists review weight calculations and clinical guidelines to adjust doses as needed. This not only improves safety, but also supports adherence by simplifying medication administrations for our families. So a common CDT or pediatric dose rounding that you might see is any dose adjustments for any antibiotics like amoxicillin for pediatric patients. And this integration ensures OHSU not only meets regulatory standards, but also leads in innovative patient care.
Now that we've covered the key features of the self-inspection forms and some of our procedures in security, controlled substance management, and collaborative practice, I'll transition to addressing some compliance challenges that we may face in this overlap between the institutional and retail self-inspection forms. The question for you, where can we improve in our maintenance of regulatory compliance? These are 3 areas we thought of, areas the board likes to dive into at OHSU, where it's especially important for all of us to have a solid understanding of what needs to be done. With respect to training and certifications, the PIC is responsible for ensuring training, initial and ongoing, and licensure for all staff is current and compliant with regulatory requirements, which are codified in ORS 689 and detailed in OAR Chapter 855, Division 41, Section 1040, which is called Outlet Policies and Procedures. These trainings are housed in a few different sites, like Compass, TRC, and Simplify 797, which many of us are familiar with. At OHSU, we have 3 policies that detail how we meet these conditions. These are the licensure and certification requirements, primary source verification of pharmacy licensure, and the education, training, and competency requirements policies, which specifies that any employees delinquent in completing these trainings may be removed from the schedule until they're complete. So all staff are required to be adequately trained before and during the performance of their duties. These requirements come from, again, OAR Chapter 855, Divisions 115, 120, and 125 for pharmacists, interns, and technicians, respectively. From a regulatory compliance perspective, the miss here is in the adherence to and completion of our assigned training modules. The board may ask to see these records during their inspection every other year, and we must be able to provide them. Hence the requirement that we retain this documentation shown on the left for 3 years. While no one necessarily enjoys completing these modules, knowing what's in them and applying that information is essential to practicing pharmacy safely and legally, which is definitely something I enjoy. Again, everyone must be trained appropriately, with additional specific training for cold drug storage. On that topic, cold drug storage is another area where compliance issues are common. These requirements come from, again, OER Chapter 855, Division 41, Section 1036, which is called Proper Storage of Drugs. The first is training. All pharmacy personnel must be trained on cold drug storage protocols specifically. This training is highly important for pharmacy staff to maintain compliance and product integrity. If a refrigerated med warms up to out of its range for even a second, it could mean all of that drug has to be thrown away. Next, thermometers. They should be placed right in the center of the fridge or freezer for accurate readings. Routine calibration is essential, and records should clearly show when the last calibration was done and when the next is due. Temperature ranges are critical. Refrigerators must stay between 2 and 8 degrees Celsius, and freezers between -25 and -10 Celsius. Any deviation from these ranges is an excursion. Excursions can occur due to equipment failure, power outages, or human error, like not closing a door all the way, and they require immediate action to protect the products inside. Finally, is documentation. When an excursion occurs, we must record specific details to ensure accountability and remain compliant. So in terms of excursion documentation, we have room to improve here, as this is a high-risk area with many steps to follow, and it's important that every piece is documented appropriately. What does appropriate documentation look like? Well, in mobile view, our temperature monitoring software, we must record when the excursion occurred, who was involved, the pharmacist's review, the actions taken, whether that's to quarantine the meds or if they can stay in use, and the source of information used, which is important to make note of, as we can use the storage and stability information from the package insert, or we can consult drug information, or calculate the MKT, which I'll get to in a second. And lastly, we need to record the identity of the pharmacist who made the final decision. Our policy at OHSU that fulfills these requirements is the aptly named Temperature Monitoring and Excursion Response Procedure. As an example of an excursion, let's say a medication refrigerator door is left open. When the temperature goes out of range, we'll get a page. Then the person with the pager must investigate and resolve the issue, close the door. They'll log into mobile view and select the action taken, that they close the door. They'll review the duration and temperature variance of the excursion and document these pieces in the notes section. To quantify this temperature variance, we can calculate the MKT, or mean kinetic temperature. If this value is below 8 degrees C for a fridge, then no further action is required and the med can still be used. If this value is over 8C, the affected meds need to be quarantined, and we'll have to email drug information to see if we can still use them. Thankfully, mobile view is set up to send a warning alert when a fridge is within 1 degree of going out of range, so that gives us some time to intervene before it becomes a real excursion. Continuing our theme of documentation that needs to be done, whenever we use an interpreter, we have to write about it in EPIC. This is another common miss, as we must include all of these pieces on the left. The applicable laws here include Section 1557 of the Affordable Care Act, which prohibits discrimination on the basis of race, color, national origin, sex, or disability, and of course, our favorite OER chapter, 855, Division 41, Section 1035, which is called Minimum Equipment Requirements. This section requires us to offer free interpretation and translation services for the public. In order to provide equal access to and participation in our healthcare programs, we do indeed provide interpreting services at no cost, as outlined in our interpreter services policy. Now I know what you're thinking. Ian, what if the interpreter only gives their first name and their registry number? Not to worry, if this happens, the Compliance and Language Services Department can find their last name, no problem, as long as you document their first name and their registry number. You don't even need to warn them. And these are the policies I went over with their respective laws for training and competency requirements, cold drug excursions, and interpreter documentation.
All right, so you've listened to all the compliance issues and you're probably thinking, how does OHSU handle those compliance issues? So we have a policy called the Pharmacy Quality Improvement Plan, and this monitors outcomes such as enhancing patient safety and ensuring compliance with regulations such as OER Chapter 855, Division 141. So this program involves continuous evaluation of service, identifying deficiencies, and also implementing corrective actions, and covers all pharmacy areas The quality dashboard is the central and main metric that tracks performance, and all of the metrics are occurred from the medication administration records, incidence reports, patient feedback, and regulatory audits. Our key players here include the pharmacy quality representative, operations managers, and the pharmacy quality and safety council. That all work closely with the pharmacist to assess risk and create corrective action plans. And if any off-target metrics are to be found, they are typically coordinated between the pharmacy quality team and service line leadership for further improvement. Okay, so we've reached the end of our roadmap. And I know you're probably sitting there for the past 45 minutes thinking, so why is all of this important? So let's go ahead and take a step back and get to the core of everything. So everything we do rests on two key foundations, such as our state regulations, our Oregon statutes and administrative rules, and our federal standards like the DEA regulations. So these serve as the playbook for pharmacy operations, guiding essential tasks such as self-inspection, controlled substance management, and accurate documentation to ensure everything runs smoothly and responsibly. Here's also a quick recap of everything we've covered today. So all of the information is outlined in the general requirements section of the PIC self-inspection form, from controlled substances to drug labeling and everything we've discussed today. These policies we went through act as a bridge between the rules we follow and the procedures we carry out every day. They're what connect the big picture regulations to the practical steps we take to stay compliant. And I know that we've also covered a ton of policies today, but let's go ahead and bring it back to the real MVP, MCN. So it's OHSU's all-in-one system for managing policies, covering everything from board requirements to federal regulations and institutional standards. So MCN ensures that we stay aligned with the latest guidelines and meet regulatory expectations. And policies within MCN typically have a maximum lifespan of 3 years before they're reviewed again. But here at OHSU, they're often updated sooner just to reflect changes in state and federal laws, so keeping us prepared and compliant at all times. So in conclusion, whether you're an intern, a technician, or a pharmacist, everyone on the pharmacy team at OSU plays an extremely vital role in keeping things running smoothly and staying compliant with state and federal laws. The work we do, dispensing medications, counseling patients, or solving problems together, is all guided by policies that ensure we remain consistent, accurate, and safe. Personally, for me, as an intern, I've seen firsthand how much of what we do really ties back to all of our policy and guidelines. And when I actually first started working with an inpatient, I started asking myself, like, why are there 50 other things to do before I get to the main task that I have to achieve? And over time, I've realized that those steps are there for a reason. And of course, it's to make sure everything we do is accurate and ultimately in the best interest of our patients. So whether you're stocking medications, documenting interactions, or troubleshooting an issue, I hope that you remember that everything we do is a part of a larger system designed to support our shared mission. So together as a team, we're upholding the highest standards of care and maybe even finding a little appreciation for those extra steps along the way. Okay, so we have a couple of our special acknowledgements we'd like to make on our screen here. So thank you so much to you guys that precepted us through this entire project. And here are references. And of course, thank you to the audience that joined us today.